Welcome back to Africa 54. We turn the spotlight on Zimbabwe in today's Africa Health Report. As our Linord Moudou tells us, new efforts are underway to improve the country's healthcare system.
My name is Dr. Emmanuel Chagonda. I'm 29 years of age. I've been working at Chiwi District Hospital for the past 11 months. When I arrived here, I was working on by myself.
Dr. Chagonda is making his morning rounds at the Chiwi District Hospital. The referral hospital serves about 18 rural clinics in the southern Zimbabwean province of Masvingo. Years of economic and political crisis have led to a collapsed healthcare system in the country. A study by the Ministry of Health and Child Welfare says about 960 women die for every 100,000 live births. Zimbabwe has one of the highest maternal mortality rates in the world. Catherine Mariposa is a nurse at the hospital.
As a professional, you get so touched, especially if you know that something could have been done. And this death was avoidable. It's so hurting.
To address the country's ailing health sector, the Zimbabwean government has created a Health Transition Fund initiative with the support of UNICEF. Zimbabwe's Minister of Health and Child Welfare, Henry Madzorera, says helping women and children is a priority.
Women and children are no longer being charged. That means access has improved. That means we are going to deal effectively with the issue of maternal mortality and neonatal child mortality.
Patients like Mercy Muchero are seeing a difference.
As soon as we got to the labor ward, the midwives took the baby and started to tend to me.
One of the main goals of the Health Transition Fund is to make sure that there are doctors and nurses in all hospitals and clinics, especially in the rural areas. To attract the best professionals, salaries are being raised and health centers have access to basic supplies and medicine. But years of poor investment and neglect in the sector are evident. Inadequate infrastructures pose huge challenges for healthcare workers, and recruiting skilled staffers takes additional time. So does restoring confidence with the public.
The biggest challenge is the health education of the mothers, to saying you should be confident with your institutions.
To improve skills and alleviate pressure on the strained resources of district and provincial hospitals, hundreds of nurses like Anna Mungara are being trained as midwives.
I applied for midwifery so that I can be trained and have the knowledge and have the skills so that I can conduct the deliveries and promote safe deliveries so that the maternal mortality and morbidity rate will become low.
In addition, the Health Transition Fund is making sure that pregnant women receive the guidance and care of village health workers throughout their pregnancy.
They come regularly to check on us and to give us advice on how to take care of ourselves and let us know when we should go to the hospital.
The most satisfying thing about the nature of my job is to see someone smiling again.
Like many of his patients at the hospital, Dr. Chagonda is hoping that Zimbabwe's government will continue to make improvements in the nation's healthcare sector. Linord Moudou, VOA's Africa Health Network.
Well, that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.